Did you know that 1 in 3 people experience shingles in their lifetime? In today's video, I'm going to be talking about the causes and symptoms of shingles and the best ways to prevent it. Let's get straight into it. Shingles, also known as herpes zoster, is a viral infection that causes a painful blistery rash. It's caused by the varicella zoster virus, which is the same virus that causes chickenpox. Now, you can't catch shingles from someone else, but you can catch chickenpox from someone with shingles, which can then reactivate in the future to cause shingles. Let me explain. Once you've had chickenpox, unlike other viruses which tend to clear from the body, the chickenpox virus actually stays inactive in the body by hiding in your nerve cells. Then one day, this virus might awaken as shingles. So chickenpox or shingles can spread to cause chickenpox, which can then reactivate in the future into shingles. No one knows exactly why the virus surfaces to cause shingles, but there are a few theories, including genetics and a lowered immune system. Studies have shown that there may be an increased risk of developing shingles if it runs in the family on the mother's side. Those with a lowered immune system are also more at risk. As we age, our immune systems tend to weaken and there is more chance of developing shingles. If you have any medical conditions that lower your immune system, such as HIV, cancer, or autoimmune disorders, you may also be more at risk. There was a study done in 2016 that found that there was an increased risk of developing shingles in those with the autoimmune disorders, inflammatory bowel disease, systemic lupus erythematosus, and rheumatoid arthritis. You're also more at risk of developing shingles if you're on medications that lower your immune system. Some examples are steroids such as prednisolone, dexamethasone, and hydrocortisone, other medications for autoimmune disorders such as methotrexate and azathioprine, and medications used to prevent transplant rejection such as cyclosporin and tacrolimus. Ask your pharmacist if you're unsure whether your medications lowers your immune system. I mentioned before that after you catch the varicella zoster virus from chickenpox or the chickenpox vaccine, it stays in the body hidden in the nerve cells near the spinal cord and the brain. Once it gets reactivated, it travels along the nerve line to the skin. The shingles rash usually appears in 1 or 2 dermatomes. Now, a dermatome is the area of skin supplied by the nerves from a single spinal root. You'll usually see it appear as a band that follows one of the nerves. Depending on which nerve line the virus travels down will determine the location. The most common locations are around the chest and the back, but can be anywhere on the body, including the legs, groin, and face. If you draw a straight line down the middle of your body, you will find the symptoms usually only appear on one side. This is because the virus travels in one direction down the nerve line. The initial symptoms you may feel are a burning, painful, itchy, tingling, or numbing sensation on one side of the body. You may also experience some symptoms such as headache, fever, tiredness, and sensitivity to light. After 1 to 5 days, a red rash with tiny bumps will appear. 2 to 3 days after the rash appears, it will develop into fluid-filled blisters. These blisters will open up, start to dry, and crust over. The scabs will then fall off after a couple of weeks. Now, the total process takes about 3 to 5 weeks. After the rash disappears, sometimes you can be left with a burning shooting nerve pain called post-herpetic neuralgia. This can last for weeks, months, or even years if you're unlucky. The older you are, the higher the chance of you developing this nerve pain. Now, your doctor will generally be able to diagnose shingles by looking at the rash. Lab tests can also be done, but it's not usually necessary. The most common complication of shingles is post-herpetic neuralgia. This is the nerve pain that we mentioned before. Other less common complications include vision loss if the shingles is near the eye, hearing loss or problem with balance if it's near the ears, a secondary bacterial infection, and inflammation of the brain, liver, and other organs. So if you start to get these symptoms, particularly on the face, make sure to see your doctor straight away to help prevent these complications. The most effective way to prevent shingles is by vaccination. The shingles vaccinations are particularly recommended if you're over the age of 60 or if you're over the age of 50 and living with someone who has a compromised immune system. Unfortunately, the vaccine has only been tested in people over the age of 50, so it's not recommended for under that age. If you've had the chickenpox vaccine before, then you have a lower chance of developing shingles than if you had chickenpox naturally. So if you haven't had chickenpox yet, speak to your doctor about getting the chickenpox vaccine. Other lifestyle tips to prevent shingles include 1. Get enough sleep. Sleep is so important for your immune system. 2. Manage stress. Try relaxation techniques or exercises to manage your stress levels. Number 3. Foods. Foods that boost your immune system, such as foods containing zinc, probiotics, lysine, and vitamins A, C, and E, may help to reduce the chance of getting shingles. If you want to know about what you can do to treat the shingles if you do develop it, you can watch my video here on shingles treatments. So that comes to the end of our video. If you found anything useful in this video, please consider subscribing. Thanks for watching, and I hope to see you next time. Bye!